Hi, my name is Tim Long. I'm the CEO and founder of New Life Medical Centers, a primary care facility. And today I'm going to talk to you about what 5 of our patients, with their personal experience with their first 4 weeks being on Recovery Master BPC 157. Now, if you don't know what Recovery Master BPC 157 is, we have another video that goes into all the details. But simply all it is BPC 157 stands for Body Protection Compound. And what it does, it helps with recovery of small or soft tissue repair. It accelerates the wound healing, whether it's muscle, ligament, tendon, nerve. It's anti-inflammatory, so if you have chronic inflammation, it helps reduce that. It's been shown to decrease pain in areas where you have injuries. It increases growth hormone receptors. Now, what's beneficial about that is when you fast, if you're a part of our protocol, we know when you fast, it increases your human growth hormone, what makes your receptors more receptive to it, to receive it. Or if you're on a secretagogue, like Empamorelin or Samorelin, something like that, which increases your human growth hormone, it's going to make it more receptive and work better. It promotes the protection of cells under stress. It helps with nitric oxide production, which helps with blood flow. It also helps heal the lining of the blood vessels. That's what nitric oxide does. It can also help with erectile dysfunction. It helps protect like a leaky gut, irritable bowel syndrome. It also protects the liver from alcohol, antibiotics, and other toxins. So it does a lot. And that's just a real quick, brief summary of what BPC 157 is. But what our patient's experience was, we had 5 different patients. 2 had tennis elbow. One had a lower back issue. One had a knee and calf issue. And one had an issue with his gut. And the one with the gut was almost kind of accidental. So what I mean by that was he got the treatment for his tendonitis, but it actually ended up helping his gut too. So here's what they experienced. The 2 guys with the tennis elbow, one of them specifically had tennis elbow for over 7 months, had done all he did, PRP 3 times, had a cortisone injection once. He was using a TENS unit, doing the rehab exercises, icing it, and working around it and doing exercises for 7 months, and it's to almost no avail. He said it would get a little bit better, literally for a few days. He'd go to work out and start to lift again, and the pain would come back. He had not done hammer curls in 7 months, and the other gentleman just was having a tendonitis that was affecting his work, and was having to work around it. Now, let me step back real quick. All these guys work out in the gym. They're all in decent shape, and some have very active jobs. So it's pretty important to them to be able to get rid of these issues. Well, the first gentleman, both guys with tennis elbow, within 2.5 weeks, both of them had the tennis elbow was gone. The pain wasn't there anymore. The one gentleman was able to tell me, he said, after 7 months, I could do hammer curls for the first time. And both of them have said the same thing is, they usually don't have any issues or any pain, even on a hard workout. They're recovered by that afternoon, or the next day they can go right back into the gym with no pain. Every once in a while, when they do extremely heavy weight, of course, now that they feel better, they're starting to lift heavy again. They'll have a little bit of a pain in the elbow, but within a couple hours, the pain is gone. They're able to go back and work out the next day with no issues. So still, those guys are still healing. As you know, it takes time with tendons and ligaments and the blood flow, but it's pretty amazing to work on rehabbing, PRP, cortisone shots, icing it, TENS unit, all that for 7 months, and then being this peptide pain's gone 2.5 weeks, and they can actually go back to the gym. Another gentleman was his lower back. Now, it wasn't the spine. It was a connective soft tissue above his glutes, and it may have been his hamstrings. He was having a lower back pain just above his glutes when he would deadlift and when he would squat or even leg press. And what would happen in his case, he would do a heavier leg press, not even a heavy squat or deadlift. He was doing primary leg press because his lower back, that pain would just not go away. But he could only work out once a week on his legs. And we like to work out twice, because by the time the pain went away, it was almost a week. And he could only work out once a week. It would affect his sleep. It affected how he moved because it would be so sore. And again, it wasn't spine. It was all soft tissue related. Well, after 2 weeks of being, actually, I think he said a week and a half of being on the peptide, the pain was gone. And he started deadlifting again, which is what he loved to do. And he was able to triple his deadlift in less than a month because the pain was gone and the recovery was there. And he said, at the end of on the last set of his deadlifts, or even his squats and heavy leg presses, he would start to get a little tight there again. He said, but 30 minutes later, it was gone. It was again like he was when he was 25 years old. And he could go back in the next day and it wasn't a problem. So he hasn't been able to deadlift in 2 years because he can never get past that pain to get to a heavy enough weight enough times to grow or getting to be able to lift heavier. So he stuck to basically leg press and leg machines for the past couple of years. Well, now he's back to squatting and deadlifting along with all the leg machines and stuff like that. And he said the pain is gone. He said if it gets tight or gets a little bit sore, it's only that way for a couple hours and it's gone. I can go back out the next day. We had another gentleman who had pulled a muscle in his back, upper back, between the shoulder blades, which we probably have all done that. In his case, he said he would usually be out about a week and a half to 2 weeks because by the time it would adjust or go back into place or just work itself out, he said the next day it was gone. So that's pretty amazing. Another gentleman with his knee and calf, same knee and calf, he'd injured it before. I think he had ACL reconstruction. Several years ago, he was lifting heavy calves, tore muscle in it, never went and got it repaired. I don't know the details of it because we haven't seen his records. But he was having lots of pain where he could not squat all the way down. After a week and a half of being on the peptide, he was able to squat all the way down again. And he says he hasn't been able to do that in a very long time. He would typically have to go to parallel and then go back up. Because if he went much lower than that, he would have a lot of pain on the backside of that knee. Well, he says now that's almost all gone. And he can actually touch the back of his hamstring to his calf again for the first time in years. So he's had a great benefit from it. As far as the gut, this gentleman, he was taking probiotics. He's in his 50s. He was taking probiotics and has been for years because if he didn't take probiotics, he would have watery bowel movements, diarrhea. And he would take the probiotics and it would still be extremely soft, but not as bad. And it helped. And he just didn't really know any better. So he just knew you had to take probiotics. Well, after only 3 days of being, 3 to 4 days of being on the Recovery Master BPC 157, his bowel movements went back to, he said, like I was 25 years old. He said, I didn't think I could be like that anymore. I didn't know how good it was, he said. So he is now no longer on probiotics. So just the money he spent on probiotics almost covers the cost of his peptide. So those are purely anecdotal results from patients that we're taking the peptide for the 4.5 weeks. That's what they experienced. That's what they are seeing. We will follow up again with them again in probably a month or two to see how they're doing. I'll give another video about it, what kind of results they're seeing. But in the first month, those are pretty awesome results. And again, that doesn't mean you're going to see the same result. Every human is different. Your genetics are different. And that doesn't mean you're going to get the same results. So, but if you are interested in getting Recovery Master BPC 157, we have it in the clinic at New Life Medical Center, and you have to see the provider. The cost for the peptide is $290 per month, and you'll have to see an office provider, physician the first month. Then you can get 3 months worth of renewals. But if you do need it or want to try it, we're glad to answer any questions that you may have. And you can just come by the clinic or give us a call, and we'll be glad to help you out as much as we can. So if you have any questions, contact us.